About that, and we'll talk about it. Piriformis situations where it's going to be tight. I was talking earlier. I really like to analyze what people are doing in a day to see what areas I should be working, because sometimes people will tell you where a problem is or where they have pain, but it's not always coming from that place. Sometimes it's referred pain. You only have 15 minutes, so if I work the place that they said hurts and it doesn't go away, then it looks like I don't know what I'm doing and I wasn't able to help them, and they go back to their desk and they didn't get any relief. So I try really hard to think about, okay, if you work in a lab, if you work at a desk, whatever you're doing, what muscles are going to be tight based on your anyway. So hip rotation as far as sitting at a desk, a guy I could see having piriformis problems more often than a girl, but anybody could. So if you're going to do it, a great way to spare your hands, one that I do a lot if I'm gonna do glute or piriformis work, is I will just use my knee. So piriformis is going to be kind of lower because it's going to be between the greater trochanter and the sacrum. So I'll use my knee, and that can spare some of my hands if my hands are getting tired throughout the day. Okay, let me try with this knee. See if I need a little bit of pressure there. There we go. How's that feel?
Good.
Feel like good pressure? So again, it's hard because if you could do movements and things, that could all help to release the piriformis, but they're in the chair. So this is going to be a way to get in it. I'll do this a lot, and it's very passive for me. I am having to kind of hold my body up, but other than that, it's not requiring a lot of strength. Sometimes I'll even take my foot and just put my foot on my leg, and so now I can press with this knee, get even more pressure. How's that feel? Good. So that's how I do it with my knee. If I was going to do it, I could do it also with, I'll use a lot of times my knuckles like this. A fist is maybe too wide sometimes and I feel like I'm going to fall if I do that, but if I use my knuckles, then I can come in here, and that probably is even more deep, yeah? So I'll just come right, I'm just filling the sacrum, just along the sacrum right here, and I'm just coming in just off the side of it and putting pressure. And this is pretty passive because I'm just using my body. And then the other way that I'll do it, again, I love to sit because I get tired standing all day. So the other way that I'll do it is I'll come in with an elbow, just sitting down, and now I can lean into it and be pretty relaxed. That's pretty deep. Yeah? How's it feel?
It's about the same as the knuckles.
Okay. And this is really passive for me. I'm even sitting, so she would think I'm being lazy, but she can't see what I'm doing. So. So these are all ways that I would have somebody stretch the piriformis. And then again, if you don't mind, just work it out. Go ahead and stand up for a minute. So a great stretch to do for piriformis that a lot of people do anyway, and you can use me as a support or you can use the chair as a support, but you'll just take your leg over your knee and then you can bend over. Do you feel that deep? Yeah.
You bend this knee too?
I do, yeah.